Topik Konversasyon. Et pareil, moi, dit, puis bonnet, dans Topik Konversasyon, aujourd'hui, nous pouvons faire un petit détour à cause, nous pas pour cause inciser sports, mais plutôt nous pour cause inciser la santé. Et nous pouvons joindre avec Managing Director Miot Hospital, qui nous joignent là bon matin pour nous cause un petit peu. Le bon service qui Miot peut faire ici, nous connaissons côté Miot était là-bas dans building l'espace. Nous pouvons causer un petit peu le bon service. Et il y en a de l'existence, il y en a 25 ans, nous pouvons voir un petit peu quoi qu'il passe pendant 25 ans, nous tous nous connaissons pour dire Miot n'est pas fini. Il est spécialisé le eye care seulement et la présence est expand to the maximum et nous voyons un petit peu quoi qu'ils ont offert et qu'ils ont plan pour les filles. Et je me rappelle, ça interview, il qui pour en anglais, justement, à cause de mon invité, Managing Director, il pour cause en anglais. Pas hésiter pour envoyer aux questions, même en créole, même en anglais, même en français, de façon que vous sentez confortable pour envoyer aux questions, ou capable d'envoyer, et Managing Director qui nous donne là, il est capable de répondre toutes les questions pertinentes, ça, c'est qui nous peut cause Lola, ladies and gentlemen, today I present you with the Managing Director of Miot Hospital. Good morning.
Hi, good morning. Je peux parler français un
petit peu. Tu peux parler français? Ah, mais tant mieux, un petit peu, hein? Tant mieux. Alors, ça va?
Oui, bien. Merci beaucoup.
Creole.
Yeah, my Creole is not great, but a lot of us from South India, because of the French colony Pondicherry, we do speak a little bit of French.
But you can make a phrase in Creole.
Well, you did tell me when we started that there's no swearing allowed.
So
I remember.
Is this what you learn in Creole?
Every time you learn a new language, those are the words that you learn first.
Better not. We don't speak Creole, no? We will speak French or English because
True.
No. So, Miot Hospital, you've been here in Seychelles for quite a while now. Like I've said to our viewers, when you started only with the eye care.
That's right.
It was in the COVID situation, right. I remember.
Right.
And now you have expand and you have take 3 or 4 floors from Espacio building.
That's true. So obviously during COVID, patients or people who are ill could not travel overseas. And we were looking at something that could be given end-to-end in terms of treatment within Seychelles. And the first thing that popped up was eye care, because the supply chain for the equipment and the services is fairly straightforward, and it's something that can be done, the treatment or the surgery can be done in the morning and you can go home in the afternoon. So during COVID, this seemed the ideal area of treatment to offer, and that's why we started off with eye care in partnership with an existing diagnostic facility in Seychelles, which was called Visus Opticals, and then we absorbed Visus Opticals and made it Miot Total Eye Care.
And at the time of COVID, I remember you have quite a waiting area which was full, a lot of walking patients as well.
Yes, it's been busy. Even today, just for eyes, we get around 25 to 30 patients a day. So for a country whose population is around 100,000, that's a decent number.
Not much.
Well, I mean, in India, we see around 100 odd patients a day. But, you know, my city has a population of 9 million. So
9 million compared to 120.
Yes.
My God, that's quite a big number. What is one of your routines like a day?
So back home in the south of India, most people wake up early. It's a hot country. The temperature is identical to the Seychelles. So usually I start work very early. I live in the hospital. I live on site, so there's no commute to work. I take an elevator to work.
Really?
So I start work at 5 in the morning. And usually by around 6:30 in the evening, I'm done.
That's the whole day.
Yes, but you know, it's a medical profession, healthcare, so you know, c'est la vie.
C'est la vie. Parce un petit peu en français, tout là, pareil, mon père dit, c'est nous cause avec Managing Director Miot Hospital, Dr. Prithvi Mohandas, qui nous a bon matin, qui nous peut causer un petit peu le bon service, qui Miot, il fait ici, c'est vous trouvez dans le bâtiment, l'espace building, you have taken the first, second and third floor?
That's right. So on the ground floor, we have the opticals. On the first floor, we have the eye diagnosis and surgery, as well as ENT surgery. On the second floor, we have specialized telemedicine and master health checkup. And on the third floor, we have ENT diagnostics, X-ray, and every month we provide general pediatric surgery services.
Pediatric as well?
Yes.
Every month?
Yes.
Voilà, ben dis moun, Miot aussi yo fait service pour pédiatrique si vous voulez passer once a month.
That's right.
Once a month. Ça veut dire une fois par mois vous fait sa service. So, what can you observe from the first, second, and third floor?
Yeah.
What can you
So I think that we wanted to provide diagnostic services, master health checkups, and treatments that can be done in one day. So if you have a problem that needs surgery, we have an anesthetist there full time, so we don't have people staying overnight. So whatever treatment you do, you have it done in the morning and you go home in the evening. Now remember, this is a rented space. We
Yes,
don't
it
own the
is.
building. But we'll go into what we're planning to do in the future because that's something you're going to touch upon later in the program.
We have questions coming in. They say, will Miot be expanding its services and what medical area that will be?
I think the two areas that we're very excited about are cancer and cardiac. So these are the two areas that we're focusing on, and we intend to take our services to our own purpose-built 4-story building by 2026.
You have been existing since, it's been 25 years.
That's right. That's
25 years, you have complete 25 years of integrity in the healthcare.
Yeah.
What will you say? What is the most important milestone?
I think a lot of healthcare entities fight to preserve compassion. Today the focus is on paperwork, the focus is on profit, and the focus is on finance. But I think really the core of healthcare is compassion, the way the medical professional behaves with the patient, the time spent really in the presence of the patient, because 50% of treatment and cure is the energy and the love that you show to the patient. And I think that is something that a lot of us focus on, we want to preserve because it's becoming more and more difficult to do so. And it is heartening for us at Miot to see that this is something that is still at the core of the organization.
We Seychelles people, I think by now, since you've been in Seychelles for quite some time now,
Yeah.
you've seen it, the behavior of we Seychelles
Sure.
people. So what would you say about your approaches to our Seychelles walk-in patients?
Right. So I came back from England as an orthopedic surgeon, but from 2008, I've been developing African markets. And I have to say that compared to the rest of the African continent, which is a tough nut to crack, Seychelles is a walk in the park. The people are so easy to deal with, relatively speaking. They're well educated, they're well informed, and generally, you know, they're pretty respectful of the sort of scenario where you have the physician sitting there and the patient on the other side. Of course, you know, in our profession, you deal with very, very bad disease. You deal sometimes with unfavorable outcomes. And I think over the last 10 years, a lot of us have been trained to deal with breaking bad news, to dealing with grief. And generally, you know, as you say, you know, what do you tell patients who are walk-in, Seychelles patients who are walk-in? You know, we focus on trying to satisfy as many people as possible. And although, you know, the impression within Seychelles is that, you know, it's a tough group of population to deal with, we don't find that to be so at all. We find that, you know, relatively speaking, we're able to manage the expectations of the people pretty well.
You manage your calm.
Yeah, definitely, yeah, yeah.
Question coming in again. What does Miot, apart from its all competitors in Seychelles,
Yeah.
what set Miot? What is the setting for Miot?
So I think the uniqueness of Miot is that none of our staff are part-time. So I
Really?
have 3,000 staff back home and around the world, and none of them work anywhere else other than with Miot. So that is a unique point because everybody is focused on developing one particular organization. They're not traveling salesmen. They're not running around because of the profit motive. This helps us keep our prices in check. This helps very greatly in quality control. And I think it helps maintain the ethos of the organization. So basically, you're hiring people who want to deliver good care rather than who want to earn a lot of money.
There is your answer to your question. So another question is the medical industry almost situated in Seychelles, or is there it's just the tip of the iceberg when it comes to supply and demand?
Well, I think Seychelles definitely has some remarkable facilities in place, especially with the Ministry of Health and the government, who are providing some excellent diagnostics and treatment. But there are certain complex areas where there is a little gap in diagnosis and in treatment of disease. Definitely the market is far from being saturated. There is a big need in certain areas, as I mentioned to you, in cancer and cardiac, because the load of disease has been increasing, especially over the last 5 to 6 years. This is not restricted to Seychelles. This load, cancer and cardiac load, has been increasing also in my own country, and this is a parallel that we see in Seychelles. So definitely far from saturated.
Again, this is your answer from Dr. Prithvi, who is the managing director of Miot Hospital. Miot Hospital est situé ici dans bâtiment espace, introducing master health checkups and an expert qui là dans Miot Hospital. Parce que tu as espace building là-bas, premier floor, deuxième floor, troisième floor, tout ça là, il est équipé. Quoi qu'il en soit, Miot will provide you with information and consultation. And our very first question since this morning, since 6, we started 6, someone was asking, why do we have to pay for consultations?
It's a very interesting point, but I think if you went to any service, whether you went to the hairdresser, or whether you went to a lawyer, or whether you went to any facility that was providing an insight into any problem, I mean, whether you want curtains, whether you want your electricity done at home, if you want advice, today it's not free.
Nothing is free.
So yeah, I mean, the problem with cost is that it has to be affordable. But the minute something is given completely free, then there's a big question mark on quality. Are you cutting corners to provide it free? Are you giving the opinion from somebody who's very well qualified? You see, everybody is a human being. Everybody needs to put food on the table. Everybody's got families and kids to support, and they've been through a long journey to get where they are.
There's lots of obligation to do.
Yeah, so you can't have a top expert giving you a fabulous cutting-edge opinion and think that it was free because somewhere somebody would have had to pay him. Otherwise, it's not going to be a very valuable opinion.
Yes. Another question from our viewers. Good morning, Carol. Good morning, Mr. He's Mr. Mohandas, and the managing director of Miot. And that person says, hope you are both fine. I am fine. Are you fine?
Oh, yes, I'm very well, thank you.
Voilà. And he says, do you provide for orthopedic services?
Yes, well, I think orthopedics has been the DNA of Miot. Miot started off as an orthopedic hospital, and over the last 3 years, year on year, Miot is the #1 orthopedic hospital in India. But you see, when you look at Seychelles, we have to, look at horses for courses. So if you look at Seychelles, one of the things that Seychelles are keen to access is diagnostic services.
Yes.
Knowing Seychelles over the years, we thought that if we provided good, meaningful, top quality master health checkup, that would be the first step in preventive medicine. And we're all talking nowadays about preventive medicine because we want to reduce the load of disease.
Yes.
Of course, the country, Seychelles, already has remarkable orthopedic services provided by the Ministry of Health. But of course, certain very complex disease that needs multidisciplinary involvement, of course, Miot will provide.
Voilà la réponse pour aux questions. We have very active viewers today. Since you are here, more question is Morning Carol and Morning Managing Director. Is Miot Seychelles planning to move in the center of town as Espace building is quite remote?
Well, that's an interesting question. You see, I come from a country of 1.5 billion people and a massive city, Chennai, which has 9 million population. So my impression was that Espace was close to town. So personally, I didn't think it was remote. But I take your point. Your point is, can we have small outreach centers so that
Yes.
people could literally fall into Miot's lap? We will look at it and we will consider it. And then let's see where we go. I mean, you know, we start off as you plant a seed and then you wait for
Let
the
it
tree to
grow.
go. So this is something we will definitely consider in the future.
If I may add to that, that will be where is Miot going? The future plans.
So as I told you, the future plan is to move to a purpose-built area in Montfleury. And we'll obviously get into the meat of that
Have you
soon.
located the space?
Yes, so we intend to partner with Dr. Jivan. The plans have been approved already.
In this area?
Yes, and it will be in the same campus. We will demolish the shops in the front and we'll build a purpose-built hospital.
Très bientôt, ça veut dire, il y en a une bonne nouvelle, mais pas certaine tigine. Avec Miot, oui, il prend la décentralisation, bien sûr, à cause nous connaissons là-bas, côté espace, pas tout le monde qui est capable d'arriver. Mais pas certaine avec Miot, il y en a une discussion qui peut gagner fait et nous sommes capables, peut-être plus tard, d'ici, je ne sais pas combien de temps, nous sommes capables de voir qu'il gagne décentralisé. What is the staff localization plan for Miot in Seychelles?
I didn't really understand what that meant. So if you could, staff localization.
Yes, maybe if you could redirect and recheck your question and resend it to us, and managing director there could give you an answer. What you've been asking about the staff localization plan for Miot in Seychelles, please, if you can just resend that with the correct question that you want to ask doctor. Let's talk about relevance of Miot in Seychelles.
Definitely. So I think that you know, the ethos of real cutting-edge, useful technology is something that is pertinent to a small island like Seychelles. So Seychelles definitely has some challenges. One of them, as you are well aware, is the affordability and accessibility of the service. Affordability means how expensive is it going to be, and accessibility means how do I avail this service? Can I have this service in-house? So when you choose technology, there's a lot of technology out there that is totally useless and that is presented by business entities as being cutting edge or being useful. And the problem we have today is because a lot of commerce in the industrial side of healthcare, technology is getting fast-tracked before it can really be meaningfully put to use. So it is important for organizations without prejudice to be treating illnesses in Seychelles so that the patients get the right treatment and the right technology so that they don't waste their resource and they have the correct access.
Voilà, la réponse. And there's a viewers that is saying that will be an awesome move from Espace to maybe branches from Montfleury. I don't know, maybe in the south area, small branches as well. So our viewer says that will be an awesome move. There's demands.
Yes, there is. So,
there is demands.
I mean, obviously the question you asked, is the market oversaturated, obviously has already been answered by one of your other viewers.
Voilà, bonne question. Pas hésiter pour continuer à envoyer bonne question pour nous, par nous peut dire, nous peut causer avec Managing Director Miot Hospital, ici Cécile, bien sûr, qui est trouvé dans le bâtiment. Espace pour le moment, premier, deuxième, avec troisième floor. I'm saving the best for last. The question will come after. There is question regarding prices. This will be the last question. I'm saving the best for the last. And you are expanding its facility. Your facility, you were from the second floor now of Espace building, and that was from yesterday?
Yes, so we received the license a few days ago, and obviously that's why I'm on the show now. And I haven't been, on this show before.
Yes, this is your first time on Bonjour Cécile.
Yes, yes. So yes, we received our license for a very specific reason. The word telemedicine has been on people's mouths for a long time. It's not a new entity. It's been around in the Seychelles for the last 3 years. But telemedicine has plainly and simply put just been video calls. For us as physicians to diagnose a patient, we need to hear the patient, we need to touch the patient, and then we need to direct the tests of the patient.
Physically?
Yes. So it's very difficult to do that on a video call where the voice is bad, the image is pretty blurred, and you can't really
there is breakage.
You can't really have any machines in the picture. So we have a product designed by an American company called Cisco. It's pretty cutting edge. It was released a year ago. We've trialed it back home and in other remote locations, and we've installed this product on the second floor in Espace building. Remarkable real-time telemedicine experience where the doctor who's sitting in another continent could even use a stethoscope on you to listen to your heart,
really?
Listen to your breathing. You could have a technician in the area here do an echo in real time with the machine attached, producing images in real time to the doctor of your heart or of your abdomen or of your liver or of your digestive tract. And it's, say for example, dermatology. So say somebody has some problem with their skin or something's not healing and a doctor wants to diagnose you. I mean, the dermatology telemedicine is just so remarkable. I mean, this is something that...
Very intelligent as well.
Yes, I saw the technology last year and I was blown away. At my age, 52, it takes a lot to blow me away. So yeah, it was incredible.
It got you this one.
Yes, so we decided it's a useful scenario for Seychelles. As I said to you, we want to bring the doctor closer to the patient. And as you said correctly, are you going to be in many locations? So yes, with the facility like this, you could have top super specialists brought literally to every single neighborhood in Seychelles.
Speaking of equipment, there is a question about equipment.
Yeah.
How is your equipment effective compared to that of the Ministry of Health?
Well, I think that the Ministry of Health has got the best equipment in the world. And the problem with technology is it changes every 6 months.
Yes.
So one of the things that we have, which I find remarkable because I'm a big technology freak, is the fact that we have an OCT machine that can do angiography of the eye. So normally to look at the blood vessels in the eye, you need to inject a dye in the patient, and it's an invasive procedure. So normally people just go have an OCT which looks at the thickness of layers in the eye, and that's it. You can't really tell the patient about the blood vessels in the eye. But we've got a really new machine which remarkably, because it's so new and because the technology was only produced a year ago, can look at the blood vessels in your eye and do an angiogram of the eye.
Really?
Yeah. So, and I'm sure the ministry will get this machine soon. It's a matter of time. It's just that we happened to need a new machine and we ordered it. So that's situated in the first floor. So if someone had a problem with blood supply of the eye and they wanted an angiogram, this machine will do it without any injection or without any dye.
How good is that? This is very good news. Seychelles, time to visit Miot Hospital, the bâtiment d'Espace, and somebody is asking about MRI.
Yes, I think that these are areas that we are definitely keen to look into. MRI is basically a magnet, and it does not make logical sense to put an MRI in a rented building, because tomorrow if your landlord says you've got to move, then you can't remove the MRI and move with it. As I said to you, we would need a purpose-built building for an MRI. So when you have a magnet, you need to make sure that the magnetic field is kept close to the patient. So around the MRI walls, you need what's called a RF cage. So these are huge investments.
Is that?
Yeah, so these are huge investments that go to, $1 million. So this is unlikely for us to set up in a rented space. But yes, these are things that can be done once we own our own
Considering
building.
it?
There are a lot of things to consider. There's, as I said to you, the two big areas for us are cancer and cardiac. I think there are so many exciting, for want of a better word, toys coming out in medical technology every year. So let's see. The future looks great.
The future looks great. Let's see what Miot will bring, we don't know, in the future. D'ici 5 ans, 6 ans, peut-être?
3 ans.
3 ans. Ah, even more good news to that. More questions coming in. If someone is in need of doing an operation with you, doesn't do here, will you be the one to organize all for them?
So a lot of operations are done here. The whole point of bringing Miot into Seychelles at the ESPAS building was to perform surgery. So we have a state-of-the-art HEPA filter, laminar airflow operating theater in the first floor. So a lot of operations can be done here, eye, ENT, children's surgery. But yes, if it's very complex and you needed to go overseas, yes, we do partner with Ministry of Health to help you go overseas. Or if you wanted to go on your own, yes, we could help you with, your visa and your travel, etc. Absolutely.
This is your answer from the managing director. Do you treat chronic myopia, eye condition?
We treat A to Z of the eye. There is no eye condition we don't treat. Yeah.
A to Z from the eye. But they started with the eye.
Yes,
back before they have expanded this time round. And we have more questions from our viewers. How important is technology in healthcare?
Well, technology is very important, but also the personnel, the person is important. See, the technology is just a tool. It's how you use the tool and how good are you at interpreting what the tool says. So the person, the physician, the doctor has to be well qualified so that he gets the maximum out of the tool. But yes, technology, as I said before, is changing, is progressing. Some of it is just amazing and some of it is, not ready yet.
Not ready.
So it's important to select carefully.
Okay. When is Miot expected to open its doors? At Montfleury? Be patient.
Well, I think, we're hoping 2026 at the latest. So let's see, we're a very energetic organization.
That's not far, 2026.
Yes, as I said, we're a very energetic organization. We like to do things as soon as we can. We like to implement as soon as we can. There are very few layers between thought and execution. So yeah, I'm very, very positive that this will happen.
Dr. Prithvi, what are some of the specialized services clients can expect in the future when you moved?
Well, really speaking, I've gone on and on about this, and I don't want to sound boring, but the focus really is on the heart and cancer, because we are seeing a lot of these conditions here in Seychelles, and we're seeing a lot of these conditions also back home in India. So we think that these are the two areas that we need to first focus, and then of course, we may include others as well.
Let's talk about Miot and Seychelles. Question is, are you personally satisfied with the level of service Miot is providing in Seychelles?
Well, that's not a question that I should answer. I've tried my best to make sure that we have a mix of amazingly positive local Seychellois working on the front line at Miot in Espace Building, as well as some very dedicated people from over the sea back home in Chennai coming here to help them. So I've put in, the biggest hearts, the bravest souls, and the newest technology that I could find, and I hope that it all comes together as a great mix and will provide services that match the expectations of the Seychellois.
Since then, Doctor, what have you learned or what have you heard in your ears from our Seychellois, from the working patients regarding Miot
Well,
services?
I think most of them are very happy. A lot of them realize that we are very comprehensive. We are not superficial. And also, I think a lot of them are very happy that we are very genuinely interested in helping and including as many people in our service, in our treatment.
What are the critics you've been getting?
Well, I think that it is very, very usual in private healthcare for people to be worried about price. This is usual. One of the challenges in price really is the cost of cutting edge equipment. If equipment has to be modern, if equipment has to be functioning at a top quality standard, then it doesn't come cheap wherever you buy it from. So it's very difficult to balance, modern, quick turnaround, non-invasive, state-of-the-art equipment with, giving it away free. But we do try our best. If you look at our X-ray unit, it is a state-of-the-art unit. From the time you come to the X-ray and finish, it takes around 10 minutes. You have your X-ray, you're given your actual film on a USB stick with a report by a senior radiologist in India, only for 200 Seychellois rupees.
That's it.
Yeah, so we try our best where we can to keep the price accessible and affordable. But in certain conditions, if you want some spectacularly new era lens in your eye, or you've had some surgery and you want some implant that's cutting edge, then it's difficult for that to be cheap. For something to function really well, for someone to be at the top of their game, it's very unlikely that they've come cheap.
So yes, the question now, I think I will ask the question now. I was saving it for the last.
Yeah.
Let's talk about prices.
Of course.
No.
Yeah. So as I said to you, we spoke about the prices of the X-ray and things like that, and we spoke about telemedicine. So we look at Seychelles over the last 14 years. We have a relationship over the last 14 years, and we look at the challenges regarding pricing. In areas where it is basically the skill of the provider, then we give it at a very reasonable cost. But in areas where, for example, if you want an angiogram of the eye, which is done non-invasively, the cost of the machine is 30,000 euros. So it's not, peanuts. But without injecting dye, without any invasive procedure, you get beautiful pictures of your blood vessels. So there has to be some sort of
Compromise.
Yeah, exactly. So
we have to compromise.
Yeah, but we are not at all in the business of only looking at our financial sheets or at our profits at the end of the year. We're genuinely looking at including as many people as possible, and a lot of the time we do partner with organizations if people have a problem, or at times we try to help them out and see how we can structure things. Because I come from a country which is not a rich country. India has 1.5 billion people, and over a half
Rich in population.
Yeah, big population, but over a half of them are still quite poor. So we have strategies back home as well, and we will use these strategies also in the Seychelles.
Okay, this question is asking, do you have an orthopedic specialist at the clinic of Miot in Seychelles? Or orthopedic
Our
doctor
aim in
specialist?
Seychelles is not to reinvent the wheel. So we didn't come to Seychelles to provide services that already exist. Our focus was to provide services that are not accessible within the country. For example, our focus now is to provide mental health. And we ran a pilot camp last month for a whole week where we focused on addiction and autism.
How was it?
It was brilliant. So, so as I said to you, these are areas that, that there are very small providers existing in Seychelles, but there are big problems. You know, no parent wants their child, you know, to do badly at school, or not to have friends, or not to blossom. And no young adult wants to lose out on his career, on his, you know, on his prospects by succumbing to either substance abuse, or it could be any other addiction. It could be gaming, it could be gambling. So these were two areas that we looked at. So we are not looking at the past, we're looking at the future.
At the future. Ladies and gentlemen, we are talking to the managing director of Miot Hospital, situated at the Espace building. They've been here since 2022 for the International Total Eye Care first, and now présent zotin fini agrandi et zot pe donne bon pe service qui zotin prend premier, deuxième et troisième floor côté bâtiment espace ou capable zis aller faire un petit gueté. So if somebody, not necessarily a patient, wants to come to Miot for a visit, for a tour, do you welcome that?
Of course we do. I mean, they would just have to call the office and book an appointment, and we've got 3 executives. 2 of them, you know, are ladies, and 1 of them is male. They're all Seychellois, and they would take them around. We've got a beautiful map that shows the facilities that we offer. So yeah, we'd be delighted if people wanted to have a tour. It's very well lit. It's very clean. It doesn't have the usual hospital smell, and I think that you will find it very welcoming.
The answer to your question, in terms of cancer treatment, present and future, what can patient expect from Miot?
One of the main scenarios of cancer is prevention, and prevention involves early pickup and accurate diagnosis. And these are the areas that we will focus on when we open in 2026 at Montfleury.
The answer to your question. More question coming in, doctor. Let's see. Good morning. Do they operate on patient with calcification of the Pyrenees plaque in Seychelles, or does the patient need to travel to India? Thank you. I think you understand that.
Calcification of what?
Of Pyrenees plaque. On peut si quelquefois aussi capable zis rediriger nous un petit guin là pour nous capable que docteur capable comprendre plus bien, moi aussi me capable comprendre plus bien pour nous capable de nous la réponse pour les moments on si error in typing le temps ou petit p quelquefois zis rediriger nous un petit peu pour nous capable connaître qui question et docteur est capable répondre aux questions par lettre nous petit peu nous type vite là nous téléphoner et puis connaît qui nous so type bonne qualité mot qui dit quoi dans dictionnaire il approprié si retire aux questions et envoyer aux questions contre nous et comme ça docteur est capable répondre. How many clients has Miot served over the years of services in Seychelles?
So if you look just at one condition, say cataract of the eye, since we opened in 2022, we've done almost 350 cataract surgeries. So this is for Seychelles, in Seychelles.
Only?
Yes, but if you look at, you know, over the last 14 years, the Ministry of Health has been sending certain patients, especially cancer, where they need certain sophisticated treatment or it's advanced for a long time. So that number is, you know, is probably over 2,000.
Wow, that's huge.
Yeah.
Doctor, Before we conclude our interview this morning, anything you would like to add to convince our Seychellois people to come and visit my Miot?
I don't think Seychellois need convincing about looking after their health. They're very switched on, they're very well informed. All I can say is that we're a very embracing organization, an inclusive organization. We are not an organization that is petty, and definitely we're not looking to make a quick buck. So we are here to stay, and we are here to grow in a way that the Seychellois want us to.
This is from Doctor. What is the collaboration like with the Ministry of Health?
Well, the collaboration is excellent. We do a lot of combined programs, especially before and after patients have been treated. A lot of the clinicians at the Ministry of Health have visited the facility in Chennai. On the administration side, we meet every month face to face, and we make sure that any queries either party has are answered immediately. The administration in terms of paperwork, in terms of finances, is working extremely well. And I think over the last 3 years, definitely the relationship is very harmonious.
There is a suggestion, not a question though.
Sure.
This person said, good morning. I personally prefer if most of your staff are expats, no offense to my fellow Seychellois brothers and sisters, but simply because of privacy. Keep that word, privacy. Our Seychellois professionals talk too much about somebody else, isn't it? Privacy and professionalism. What do you think about this?
Well, I think that you can't paint everybody with the same brush. We've come across some amazing young talent in the Seychelles who are motivated, who could perform in any platform anywhere in the world. Their commitment to quality of care and patient confidentiality is paramount. A lot of it has got to do with training. A lot of it has got to do with an inspiration from the top. As you know, I live on site in Miot. I'm there from 5 in the morning to 6:30 in the evening. I see virtually every overseas patient every day myself. So I think when you have a good leadership, as they do here also in Espace, automatically you will get the work ethos. Yes, every human being in every country likes to gossip, but that's a different scenario. Our profession, like education, like the military, is a profession where there is a lot of confidentiality involved. And I think that once you come into the ethos of the profession, you automatically imbibe the virtues required. So I don't think people need to worry that just because their countrymen are there, the information is going to be leaked. Not at all.
However, will you tolerate that?
So we are extremely strict with patient confidentiality. A lot of the patient data is protected. It's impossible for you to access a patient's information unless you are treating the patient. So yeah, and definitely even when we do ward rounds, we make sure that people aren't walking around here and there, that they are in their work areas, so that, as you say correctly, they don't overhear something about some other person's condition. And yeah, and as you say, will you tolerate that? Of course not. I mean, it's similar to, will any military tolerate secrets being shared with an enemy, or will any parent tolerate the child's information in school being shared with another parent? Of course not. This is something that is, it's sacred.
Dr. Prithvi Mohandas, Managing Director of Miot Hospital, who has joined me this morning in the Topik Konversasyon for a conversation of the services that Miot Hospital is offering here in Seychelles. Any last word?
No, I think that, we are very excited about the Seychelles. We are very pleased to be here. We find that we've had a great welcome. We've had an amazing relationship, not just with the Ministry of Health, but with the government at large. And we are looking very much to build on this relationship to make it a happy, everlasting marriage.
Until death do us part. Cécile, aujourd'hui bon matin, nous cause bien sûr avec Dr. Prithvi Mohandas, who is the Managing Director of Miot International India. Après aussi Cécile, bien sûr, nous peux causer un peu le bon service. Merci pour bonne question qui vous envoie pour nous. Nous connaissons très concerné contre nous la santé y concerne. Alors, pourquoi pas rendre une petite visite Miot Hospital dans le bâtiment l'espace, voir bandi moun va diriger côté pour aller qui maladie ou non, ben là il a pour capable sauver dans quelque chose. Mais si vous sentez un petit douleur, quelque chose qui est abnormal, just report to the doors of Miot and they will guide you and they will help you. C'est ça, c'est notre topic conversation pour aujourd'hui. Bon matin.